Welcome to another video of 100 important MCQs. Unit 5. Let's dive. 1. What is the principle of the enzymatic method for glucose estimation using glucose oxidase? A. The reduction of NADP and to NADP. B. The reduction of oxygen to hydrogen peroxide. C. The hydrolysis of starch to glucose. D. The oxidation of glucose to gluconic acid and hydrogen peroxide. Answer, D. 2. In the calibration of a glucose oxidase assay, what is typically used as the calibrator? A. Glucometer. B. Glucose standard solution. C. Serum sample from a healthy individual. D. Sodium chloride solution. Answer, B. 3. What precaution should be taken while handling glucose oxidase reagents? A. Avoid exposure to air to prevent reagent oxidation. B. Store the reagent in a hot environment to prevent contamination. C. Use fresh reagents only after opening the container. D. Keep the reagents under direct sunlight for maximum efficacy. Answer, A. 4. In the Berthelot method for urea estimation, what is the colorimetric reagent used to form a blue complex? A. Sodium hydroxide and copper sulfate. B. Sodium phenate and hypochlorite. C. Sodium bicarbonate and sodium carbonate. D. Ammonium molybdate and phosphoric acid. Answer, B. 5. In the estimation of urea, which of the following represents the normal range of urea in serum? A. 2.5 to 6.5 mg/dl. B. 6.0 to 12.0 mg/dl. C. 10.0 to 20.0 mg/dl. D. 15.0 to 25.0 mg/dl. Answer, B. 6. What is the principle behind the measurement of serum amylase activity using a starch substrate? A. Measurement of the reduction in starch concentration. B. Hydrolysis of starch into glucose, measured by absorbance. C. Measurement of the increase in starch concentration. D. Hydrolysis of starch into maltose, which is then measured by absorbance. Answer, B. 7. What is the normal value range for serum amylase activity? A. 10 to 40 IU/L. B. 20 to 80 IU/L. C. 30 to 120 IU/L. D. 60 to 200 IU/L. Answer, B. 8. Which of the following substrates is used in the measurement of alanine aminotransferase, ALT, activity? A. Pyruvate and glutamate. B. Glutamate and oxalostate. C. Aspartate and alpha-ketoglutarate. D. Glutamate and alpha-ketoglutarate. Answer, D. 9. What is the normal reference range for ALT, GPT, in serum? A. 0 to 35 IU/L. B. 10 to 40 IU/L. C. 15 to 45 IU/L. D. 20 to 70 IU/L. Answer, B. 10. What is the difference between the measurement of GPT and GOT? A. GPT measures alanine, while GOT measures aspartate. B. GPT measures aspartate, while GOT measures alanine. C. Both enzymes measure alanine. D. Both enzymes measure aspartate. Answer, A. 11. What is the normal range for serum GOT, AST, activity? A. 5 to 25 IU/L. B. 10 to 40 IU/L. C. 15 to 50 IU/L. D. 10 to 20 IU/L. Answer, B. 12. Which of the following is the most commonly used method for estimating acid phosphatase activity? A. Spectrophotometry with p-nitrophenyl phosphate as substrate. B. Colorimetric assay with malachite green. C. Enzyme-linked immunosorbent assay, ELISA. D. Fluorometric assay using fluorescein diacetate. Answer, A. 13. What is the normal value for serum acid phosphatase activity in men? A. 0.5 to 2.5 IU/L. B. 2.5 to 6.0 IU/L. C. 3.5 to 7.5 IU/L. D. 5.0 to 8.0 IU/L. Answer: B. 14. In the estimation of alkaline phosphatase, ALP, activity, which substrate is commonly used? A. P-nitrophenyl phosphate. B. Sodium citrate. C. Sodium bicarbonate. D. Sodium chloride. Answer: A. 15. What is the normal range for alkaline phosphatase, ALP, activity in adults? A. 30 to 85 IU/L. B. 40 to 130 IU/L. C. 50 to 150 IU/L. D. 60 to 160 IU/L. Answer: B. 16. What is the principle of the colorimetric method for serum calcium estimation using ocre-sulfaline complexone? A. Calcium forms a red complex with ocre-sulfaline. B. Calcium reacts with ocre-sulfaline to form a yellow complex. C. Calcium reacts with arsenizo-3 reagent to form a blue complex. D. Calcium reacts with a copper reagent to form a purple complex. Answer: A. 17. What is the normal reference range for total serum calcium? A. 8.0 to 10.0 mg/dl. B. 8.5 to 10.5 mg/dl. C. 9.0 to 11.0 mg/dl. D. 9.5 to 11.5 mg/dl. Answer: B. 18. What method is typically used for the estimation of inorganic phosphorus in serum? A. Spectrophotometric method using ammonium molybdate. B. Fluorometric method with fluorescein as the reagent. C. Gravimetric method using magnesium phosphate. D. Colorimetric method using thiobarbituric acid. Answer: A. 19. What is the normal reference range for serum phosphorus? A. 1.5 to 3.5 mg/dl. B. 2.0 to 4.0 mg/dl. C. 2.5 to 4.5 mg/dl. D. 3.0 to 5.0 mg/dl. Answer: C. 20. In the estimation of serum sodium, which method is commonly employed? A. Flame photometry. B. Ion selective electrode. C. Colorimetry with sodium benzoate. D. Enzymatic assay using sodium chloride. Answer: A. 21. What is the normal range for sodium concentration in serum? A. 135 to 145 mol/L. B. 130 to 140 mol/L. C. 120 to 130 mol/L. D. 140 to 150 mol/L. Answer: A. 22. Which method is commonly used for the estimation of serum potassium? A. Flame photometry. B. Ion selective electrode. C. Spectrophotometry using potassium dichromate. D. Colorimetry using potassium ferrocyanide. Answer: B. 23. What is the normal reference range for serum potassium? A. 3.5 to 5.0 mol/L. B. 2.5 to 3.5 mol/L. C. 4.0 to 5.5 mol/L. D. 5.0 to 6.0 mol/L. Answer: A. 24. Which reagent is typically used in the estimation of chloride ions in serum? A. Mercury thiocyanate. B. Silver nitrate. C. Copper sulfate. D. Potassium dichromate. Answer: B. 25. what is the normal reference range for chloride concentration in serum? A. 90 to 110 mol/L. B. 95 to 105 mol/L. C. 100 to 120 mol/L. D. 105 to 115 mol/L. Answer: A. 26. In the JAF method for creatinine estimation, which reagent reacts with creatinine to form a red-orange complex? A. Picric acid. B. Sodium hydroxide. C. Potassium dichromate. D. Ninhydrin. Answer: A. 27. What is the normal reference range for serum creatinine? A. 0.5 to 1.0 mg/dl. B. 0.6 to 1.2 mg/dl. C. 0.7 to 1.3 mg/dl. D. 1.0 to 1.5 mg/dl. Answer: B. 28. In the estimation of total serum cholesterol, which enzyme is involved in the reaction to form hydrogen peroxide? A. Cholesterol esterase. B. Cholesterol oxidase. C. Lipase. D. Phospholipase. Answer: B. 29. What is the normal reference range for total serum cholesterol? A. 100 to 200 mg/dl. B. 150 to 250 mg/dl. C. 150 to 200 mg/dl. D. 200 to 250 mg/dl. Answer: C. 30. Which enzyme is responsible for hydrolyzing triglycerides during the estimation of serum triglycerides? A. Lipase. B. Amylase. C. Protease. D. Phospholipase. Answer: A. 31. What is the normal reference range for serum triglycerides? A. 30 to 150 mg/dl. B. 50 to 200 mg/dl. C. 80 to 180 mg/dl. D. 100 to 250 mg/dl. Answer: A. 32. Which of the following methods is most commonly used for measuring HDL cholesterol? A. Precipitation with dextrin sulfate. B. Precipitation with phosphotungstic acid. C. Enzymatic assay with HDL-specific enzymes. D. Ultracentrifugation. Answer: A. 33. What is the normal reference range for HDL cholesterol? A. 30 to 60 mg/dl. B. 40 to 90 mg/dl. C. 50 to 70 mg/dl. D. 60 to 100 mg/dl. Answer: C. 34. Which equation is commonly used to estimate LDL cholesterol in serum? A. Friedewald equation. B. Pearson equation. C. Simpson equation. D. Wallace equation. Answer: A. 35. What is the normal reference range for LDL cholesterol? A. 50 to 100 mg/dl. B. 70 to 130 mg/dl. C. 90 to 160 mg/dl. D. 100 to 150 mg/dl. Answer: B. Q36. Which method is commonly used for the estimation of serum uric acid? A. Uricase method. B. JAF method. C. Urease method. D. Phenol method. Answer: A. 37. What is the normal reference range for serum uric acid? A. 2.0 to 5.0 mg/dl. B. 3.0 to 7.0 mg/dl. C. 4.0 to 8.0 mg/dl. D. 5.0 to 10.0 mg/dl. Answer: B. 38. What is the principle of the Biuret method for protein estimation? A. Proteins react with copper ions to form a purple complex. B. Proteins react with phenol to form a red complex. C. Proteins react with ninhydrin to form a yellow complex. D. Proteins react with aldehyde groups to form a green complex. Answer: A. 39. What is the normal reference range for total protein in serum? A. 6.0 to 8.5 g/dl. B. 7.0 to 9.0 g/dl. C. 5.0 to 7.0 g/dl. D. 4.5 to 6.5 g/dl. Answer: A. 40. What reagent is used in the diazo method for the estimation of total bilirubin? A. Sodium nitrite. B. Diazo reagent. C. Sodium carbonate. D. Potassium dichromate. Answer: B. 41. What is the normal reference range for total bilirubin in serum? A. 0.1 to 1.2 mg/dl. B. 0.2 to 1.0 mg/dl. C. 0.5 to 2.0 mg/dl. D. 0.3 to 1.5 mg/dl. Answer: A. 42. What is the normal value of fasting blood glucose? A. 70 to 100 mg/dl. B. 80 to 120 mg/dl. C. 90 to 130 mg/dl. D. 60 to 90 mg/dl. Answer: A. 43. In glucose estimation, what is the effect of hemolysis on results? A. Hemolysis has no effect on glucose levels. B. Hemolysis causes a decrease in glucose levels. C. Hemolysis causes an increase in glucose levels. D. Hemolysis can result in false positives. Answer: C. 44. In urea estimation using the Berthelot method, what is the role of sodium hypochlorite? A. It reduces urea to ammonia. B. It reacts with ammonia to form a blue color. C. It oxidizes the reagent to increase color intensity. D. It neutralizes the acid in the solution. Answer: B. 45. What is the effect of hemolysis on urea estimation? A. Hemolysis has no effect on urea levels. B. Hemolysis may lead to a falsely low result. C. Hemolysis can cause an increase in urea levels. D. Hemolysis can affect calibration. Answer: B. 46. In the serum amylase assay, what is the primary substrate for amylase? A. Maltose. B. Starch. C. Glucose. D. Sucrose. Answer: B. 47. What is the impact of hemolysis on amylase estimation? A. Hemolysis has no effect. B. Hemolysis decreases amylase levels. C. Hemolysis increases amylase levels. D. Hemolysis leads to false negatives. Answer: C. 48. Which of the following reactions is catalyzed by alanine aminotransferase, ALT? A. Aspartate and alpha-ketoglutarate glutamate and oxalostate. B. Alanine and alpha-ketoglutarate pyruvate and glutamate. C. Glutamate and oxalostate aspartate and alpha-ketoglutarate. D. Pyruvate and glutamate alanine and oxalostate. Answer: B. 49. What is the diagnostic significance of elevated levels of AST, GOT? A. Liver injury, myocardial infarction, and muscle disorders. B. Renal failure and electrolyte imbalances. C. Pancreatic inflammation and infection. D. Iron deficiency anemia and thyroid disorders. Answer: A. 50. Which of the following is the normal ratio of AST to ALT in healthy individuals? A. 0.5-1.5. B. 1.02.0. C. 1.03.0. D. 2.04.0. Answer: A. 51. What condition is commonly associated with elevated serum acid phosphatase levels? A. Hyperparathyroidism. B. Prostate cancer. C. Acute pancreatitis. D. Liver cirrhosis. Answer: B. 52. What is the substrate commonly used in the acid phosphatase assay? A. P-nitrophenyl phosphate. B. Sodium phenate. C. Sodium chloride. D. Pyrophosphate. Answer: A. 53. In which of the following conditions is alkaline phosphatase most elevated? A. Cholestasis. B. Hyperkalemia. C. Renal failure. D. Hemolytic anemia. Answer: A. 54. What is the primary purpose of alkaline phosphatase in the body? A. Hydrolysis of phosphate esters. B. Hydrolysis of triglycerides. C. Catalyzing transamination reactions. D. Synthesis of ADP. Answer: A. 55. Which of the following factors can cause falsely low serum calcium levels? A. High albumin levels. B. Hemolysis of the sample. C. Low magnesium levels. D. High vitamin D levels. Answer: B. 56. Which of the following enzymes is responsible for the regulation of calcium homeostasis? A. Parathyroid hormone. B. Cortisol. C. Insulin. D. Thyroxine. Answer: A. 57. What is the effect of renal failure on serum phosphorus levels? A. Decreases phosphorus levels. B. Increases phosphorus levels. C. No effect on phosphorus levels. D. Fluctuates phosphorus levels. Answer: B. 58. Which method is employed for direct measurement of sodium concentration in serum? A. Potentiometric method using ion-selective electrodes. B. Colorimetric method. C. Gravimetric method. D. Absorption spectroscopy. Answer: A. 59. What is the effect of hemolysis on potassium levels in the sample? A. Decreases potassium levels. B. No effect on potassium levels. C. Increases potassium levels. D. Results in an unreliable result. Answer: C. 60. In which of the following conditions is chloride concentration elevated? A. Dehydration. B. Respiratory alkalosis. C. Metabolic acidosis. D. Hypercalcemia. Answer: A. 61. In kidney function tests, why is creatinine often preferred over urea for assessing renal clearance? A. Urea levels are more variable due to diet and hydration status. B. Creatinine levels are less influenced by diet and hydration status. C. Creatinine is more commonly used in metabolic disorders. D. Urea levels reflect only glomerular filtration rate, GFR. Answer: B. 62. What is the diagnostic significance of elevated total cholesterol levels? A. Cardiovascular diseases. B. Kidney disease. C. Liver diseases. D. Hemoglobin disorders. Answer: A. 63. Which of the following conditions is associated with elevated triglycerides? A. Hyperthyroidism. B. Liver cirrhosis. C. Diabetes mellitus. D. Hypothyroidism. Answer: C. 64. Which of the following factors decreases HDL cholesterol? A. Physical activity. B. Smoking. C. High fiber diet. D. Alcohol consumption. Answer: B. Smoking. 65. Which of the following conditions is associated with low LDL cholesterol? A. Atherosclerosis. B. Liver disease. C. Hypothyroidism. D. familial hypercholesterolemia. Answer, B. 66. Which condition is typically associated with elevated uric acid levels? A. Gout. B. Cirrhosis. C. Hyperthyroidism. D. Anemia. Answer, A. 67. In the Biuret method for protein estimation, the color intensity is directly proportional to which factor? A. The concentration of copper ions. B. The concentration of protein. C. The temperature of the reaction. D. The pH of the reaction. Answer, B. 68. Which of the following is the most likely cause of elevated direct bilirubin levels? A. Hemolysis. B. Obstructive jaundice. C. Hepatitis. D. Gilbert's syndrome. Answer, B. 69. In the estimation of blood glucose using the glucose oxidase method, which of the following is the byproduct formed after the enzyme reaction? A. Hydrogen peroxide. B. Sodium chloride. C. Carbon dioxide. D. Gluconic acid. Answer, A. 70. Which reagent is commonly used in the urease method for urea estimation? A. Ammonium chloride. B. Sodium bicarbonate. C. Sodium hydroxide. D. Sodium hypochlorite. Answer, C. 71. What is the optimal temperature for measuring amylase activity? A. 25 degrees Celsius. B. 30 degrees Celsius. C. 37 degrees Celsius. D. 40 degrees Celsius. Answer, C. 72. What is the common substrate used in the ALT assay? A. Glutamate. B. Pyruvate. C. Oxalostate. D. Alpha-ketoglutarate. Answer, D. 73. Which coenzyme is required for the activity of AST, GOT? A. NADH. B. NADF. C. Vitamin B6, pyridoxal phosphate. D. FADH2. Answer, C. 74. The detection of acid phosphatase is particularly useful in diagnosing which type of cancer? A. Prostate cancer. B. Colorectal cancer. C. Lung cancer. D. Breast cancer. Answer, A. 75. Alkaline phosphatase activity is elevated in which of the following conditions? A. Osteomalacia. B. Hyperlipidemia. C. Hypothyroidism. D. Renal failure. Answer, A. 76. Which of the following ions is essential for the proper functioning of calcium channels in muscles? A. Magnesium. B. Potassium. C. Sodium. D. Chloride. Answer, A. 77. In the determination of inorganic phosphorus in serum, which color change is observed when ammonium molybdate is added? A. Blue. B. Red. C. Yellow. D. Green. Answer, A. 78. What is the primary function of sodium ions in the body? A. Maintenance of acid-base balance. B. Regulation of blood pressure and volume. C. Muscle contraction. D. Protein synthesis. Answer, B. 79. Which of the following methods is commonly used for measuring serum potassium? A. Ion selective electrode, ISE. B. Flame photometry. C. Absorption spectroscopy. D. Precipitation with silver nitrate. Answer, A. 80. Which of the following methods is used to estimate chloride levels in serum? A. Titration with silver nitrate. B. Precipitation with potassium chromate. C. Spectrophotometric assay. D. Potentiometric measurement using a chloride electrode. Answer, A. 81. which of the following conditions leads to elevated serum creatinine levels? A. Acute kidney injury. B. Liver cirrhosis. C. Chronic obstructive pulmonary disease. D. Hyperthyroidism. Answer: A. 82. In the enzymatic method for cholesterol estimation, which enzyme hydrolyzes esterified cholesterol? A. Cholesterol esterase. B. Lipase. C. Amylase. D. Protease. Answer: A. 83. In the enzymatic method for triglyceride estimation, what is the main product formed after lipase hydrolyzes triglycerides? A. Glycerol and fatty acids. B. Glycerol and glucose. C. Glycerol and pyruvate. D. Glycerol and acetyl-CoA. Answer: A. 84. What is the role of heparin in the precipitation method used for estimating HDL cholesterol? A. It binds to LDL and VLDL particles to precipitate them. B. It binds to HDL particles to prevent them from precipitation. C. It activates the enzyme that hydrolyzes cholesterol. D. It acts as a stabilizer for the reaction mixture. Answer: A. 85. Which method is commonly used for calculating LDL cholesterol levels? A. Friedewald formula. B. Schwartz equation. C. Lahey method. D. Lard method. Answer: A. 86. Which of the following conditions is most likely to cause an increase in uric acid levels in the blood? A. Gout. B. Hypothyroidism. C. Dehydration. D. Hyperparathyroidism. Answer: A. 87. Which reagent is commonly used in the Biuret test for protein estimation? A. Copper sulfate. B. Ammonium chloride. C. Sodium hydroxide. D. Sodium citrate. Answer: A. 88. What is the normal total bilirubin level in adults? A. 0.1 to 1.2 mg/dl. B. 0.2 to 1.5 mg/dl. C. 0.3 to 2.0 mg/dl. D. 0.5 to 1.0 mg/dl. Answer: A. 89. In the glucose oxidase method, which of the following is used to measure the hydrogen peroxide produced during the reaction? A. Potassium permanganate. B. Chromogen reagent. C. Potassium dichromate. D. Diacetyl. Answer: B. 90. What is the primary product formed in the urease method for urea estimation? A. Ammonia. B. Nitrogen gas. C. Uric acid. D. Hydrochloric acid. Answer: A. 91. In the enzymatic assay for amylase, which of the following substrates is typically used? A. Starch. B. Glucose. C. Maltose. D. Lactose. Answer: A. 92. The alanine aminotransferase enzyme is predominantly found in which organ? A. Liver. B. Kidney. C. Heart. D. Pancreas. Answer: A. 93. In a patient with myocardial infarction, what is the trend of AST levels in the initial 24 hours? A. Rapid decrease. B. Rapid increase followed by a slow decrease. C. No significant change. D. Gradual increase. Answer: B. 94. Which form of acid phosphatase is primarily used in the diagnosis of prostate cancer? A. Tartrate-resistant acid phosphatase. B. Tartrate-sensitive acid phosphatase. C. Alkaline phosphatase. D. Beta-glucuronidase. Answer: A. 95. Alkaline phosphatase levels are often elevated in patients with which disease? A. Paget's disease. B. Hyperparathyroidism. C. Cirrhosis. D. Both A and B. Answer, D. 96. What is the function of parathyroid hormone, PTH, in calcium metabolism? A. Increases calcium excretion by the kidneys. B. Stimulates calcium absorption in the intestines. C. Decreases calcium release from bones. D. Decreases calcium absorption in the intestines. Answer, B. 97. What is the principle behind the colorimetric method for phosphorus estimation? A. Phosphorus reacts with molybdate to form a blue-colored complex. B. Phosphorus forms a yellow precipitate with barium chloride. C. Phosphorus reacts with iodine to form a purple color. D. Phosphorus reacts with copper to form a red complex. Answer, A. 98. Which method is frequently used for the direct measurement of sodium in blood samples? A. Flame photometry. B. Colorimetry. C. Spectrophotometry. D. High-performance liquid chromatography, HPLC. Answer, A. 99. Potassium ions are critical in maintaining A. Muscle contraction and nerve transmission. B. Calcium regulation. C. Oxygen transport in blood. D. Lipid metabolism. Answer, A. 100. The normal serum chloride concentration in adults typically ranges between A. 90-110 milliequivalent/L. B. 95-105 milliequivalent/L. C. 100-120 milliequivalent/L. D. 120-130 milliequivalent/L. Thank you for watching. For more videos, subscribe the channel and don't forget to like the video. Also turn on the notification bell to get latest updates.